Hi, my name is Nancy Abigail Liceo Lopez. I am going to talk about the vital signs. The objective is vital signs reflects essential body functions, including heart rate, breathing rate, temperature, and blood pressure. Your healthcare provider can observe, measure, and monitor your vital signs to access your level of physical function. To recap, normal vital signs ranges for Avenger healthy adults at rest are blood pressure, this is 90-60, and breathing 12-20 beats per minute, and pulse 60-100 200 beats per minute. Temperature is 30-60.5 and 50-70.3. The heart rate pulse is heart rate or pulse is the number of times a heart beats per minute. Heart rates vary by person, and a normal pulse can range between 60 to 100 beats per minute. An individual's heart rate can fluctuate considerably due to fitness level, illness, injury, emotional state. Even the temperature of the room can affect heart rate. Highly trained athletes, for example, many have a normal resting heart rate closer to 14 beats per minute, and this is still considered acceptable. With some specific patients with vitals outside of the 60 to 100 beats per minute range will very likely be sent for additional testing, especially if the patient have other symptoms such as the signs or symptoms of breath. Most often, an investigation into the heart starts with an electrocardiogram or EKG, for relatively simple cardiac measurement. To take heart rate, 1. Wash your hands. 2. Make sure that individual is at rest before you begin. 3. The easiest place to find a pulse to measure is the radial artery found on the inside of the wrist closest to the thumb. Alternatively, you can find the pulse on the side of the elbow, brachial artery, brachial the queen pupillary artery, or neck carotid artery. For use, first and second fingertips near the thumb to press firmly but gently on the wrist, or otherwise until you feel a pulse. 5. With an analog clock or watch, wait until the seconds and is on the 12. 6. Begin counting the beats of the pulse. 7. Count pulse for 60 seconds and until the second heart restores to the 12. You may also count for 15 seconds and multiply before to calculate beats per minute. 8. When counting, do not watch the clock continuously but concentrate on the breaths of the pulse. Respiratory rate. Respiratory rate, something referred to as breathing rate, is the number of breaths taken per minute. This measurement is always taken when the individual is at rest. A single respiration counting is equal to the chest raising, inhalation, and firing exhalation of bones. The normal range for an adult is 12 to 28 respirations per minute. To take respiration rate, 1. Wash your hands. 2. Place your fingers on the individual wrist exercise. 3. Count breaths in for example, 1 respiration for 1 minute. For document respiration rate, noting an observation such as squishing. These factors list fever, agitation, illness, age, and even sleep can have an effect of breathing and 3 for the respiration rate. Respiration rate fluctuations are often seen as an early warning for critically ill hospital patients, and it is closely monitored within acute care setting. Body temperature. Put simply, body temperature is the amount of air in the body. Core body temperature is controlled via process called thermoregulation. No individual has the exact temperature reading throughout the days as body temperature naturally fluctuates. Temperature is considered normal at 98.6 degrees, about 37 degrees, although anything between 97.6 degrees, 36.4 degrees to 99.6 degrees and 37.5 degrees is acceptable, and temperature over 100.4 degrees and 38 degrees indicates a fever caused by illness or injury. Hypothermia. Low temperature occurs when the body temperature dips below 95 degrees and 35 degrees. To take body temperature, 1. Wash your hands. 2. Cover thermometer mount tip with a clean plastic shield or clean before and after use for glass. 3. Press button to set the thermometer. 4. Place thermometer under tongue and instructive individual to place mount. 5. Wait several minutes. Remove temperature when beeping indicates the reading is complete. 6. Document temperature including the date, time, and method used as follows. For oral R for rectal, E for ear, A for axilla. 7. Clean and sterilize the thermometer. Note: oral thermometers are not indicated for some individuals, such as those with a history of seizures. Digital thermometers can be used to take an exact temperature being placed under the armpit against dry skin for 5 minutes. Blood pressure. Blood pressure is a reading of how effectively the oxygen blood is moving towards the blood vessels of the circulatory system. Blood pressure is expressed in two parts. Systolic pressure, the pressure created when the blood pumps from the heart into the arteries. Over diagnostic pressure, the pressure inside the artery as the heart rests between beats. This is a measurement with two numbers recorded as millimeters of mercury and written as systolic, diastolic. Instruments used to take blood pressure include a stethoscope, blood pressure cuff with inflatable balloon, seismometer, and number pressure con caída diagnostic monitor or aneroid monitor. To take blood pressure using a stethoscope called an aneroid monitor. 1. Wash your hands. 2. Disinfected stethoscope, earpieces, and diaphragmatic round disc. 3. Check to make sure that the blood pressure monitor is in good working order. 4. Place fingers on the underside of the elbow to locally gauge the brachial pulse. 5. Grab and faster deflated cause slunging around the upper arm and the last 1 inch upward where you felt a strong and steady brachial pulse. 6. Insert stethoscope earpiece and position diaphragm directly over the brachial pulse. 7. Turn the drum on the air pump clockwise to close the valve. 8. Pump air inflating the arm cuff until the dial pointer reaches 170. 9. Henley turn the knob on the air pump clockwise to open the valve and deflect the cuff. 10. As the dialer points falls, watch the number and listen for a tapping sound. 11. Note the number shown where the first drum is heard, systolic pressure. 12. Note the number shown where the last drum is heard, diastolic pressure. 13. Deflate and remove cuff. 14. Document the reading rating as systolic, diastolic, and not unusually observations. Thank you.